Hey everybody, it's Sherry Tutkus
And Dale Buckman.
and welcome to Green Nurse Radio Show, Living Our Best Life. Tonight,
We have a really special show tonight.
yeah, cannabis and sex, right? We have a very special guest, Jordan Tishler. He's Dr. Jordan Tishler. He's a medical doctor with inhaleMD. He is a Harvard graduate, Harvard Medical School, Brigham and Women's Hospital, emergency room physician, and he's worked with veterans. We have a really exciting show tonight because, as we all know, the endocannabinoid system regulates all of the other body systems, including our reproductive system. And the biggest question we have for him is, can cannabis improve our sex lives, improve intimacy in our lives, and help us to live our best life?
Yeah.
First, we're going to plug ourselves because that's what we do every show.
This is our favorite part.
Plug. I know. What is a green nurse? What does it mean to be a green nurse, Dale?
So as you know, everything is not about cannabis, and we're always talking about everything that's involved in good health. So biopsychosocial, spiritual aspect of health, the diet and nutrition, good sleep,
Exercise,
social
stress,
engagement, stress
right,
management.
whole health. Being a green nurse and the green nurse philosophy surrounds whole health, the entourage of health, total health care, biological healing, physical healing, emotional, psychological, mental, how we interact with people, and our connection to the unseen world. Right? So we talk, that's what the green nurse really is all about, because on our journeys of healing, as holistic healing nurses, we know that it's a one-size-fits-all approach does not work.
And everybody has a story.
And everybody has a story.
Right.
So greennurse.com is coming, and basically what we're going to have at greennurse.com is a green nurse library. Research.
Connecting people to research and information and articles that are important to them so they can understand.
And substantiation files, because if we're going to say something and we're going to be bringing professionals on to tell their stories, we want to be able to substantiate what we say with current research that is out there, and you'll be able to find that on greennurse.com.
It's coming soon.
Right. Green nurse on the go. I mean, we always talk about that.
I know, and it's one of our favorite things because we love getting out into the community, and we love bringing education to the community because it's all about learning and
trying to decrease the stigma and to learn how cannabis can possibly fit into your life to help you to live a good life. Green Nurse on the Go, we bring you information that you wouldn't get anywhere else. We're bringing community together. Part of my story is about how the recreational community embraced me when I was very sick and helped me to start living my best life so I could get back to being a nurse. And the stories that we bring on, the patients that we work with, and the people that are telling their stories about how cannabis has helped them heal, not only helps them to continue on their healing trajectory, but it also brings hope to people that are listening.
That's an important piece.
And hope is really important. So let's get to the meat and potatoes. We're going to be talking about penises and vaginas tonight, as well as cannabis, intimacy. Dr. Tishler, welcome.
Thank you so much.
Thank you guys for having me. It's a pleasure to be here.
Everyone has a story, and basically, you went to Harvard.
It's true.
You went to Harvard Medical School.
That is also true.
Practicing physician, Brigham and Women's Hospital, emergency room. What is why cannabis?
Well, it's all true. And so I come from sort of a very traditional background, right? The Harvard this and Harvard that. And
Preparation H.
Preparation H, exactly. And so, I spent about 15 years being an emergency room physician for the VA in West Roxbury. And when you do that, you see a lot of veterans who've really been harmed by drugs and alcohol. And let me just point out, alcohol far and away above even number 2. But obviously opiates and other medications as well. You sort of become kind of an expert in the trial by fire of how these things present and how you take care of people like that. Right. Somewhere around 2011, when Massachusetts started to entertain the idea of cannabis as medicine, I started thinking, I've never seen anybody sick from cannabis. You would see patients come in and they might have cannabis use disorder on their problem list, but never saw anybody sick. Sort of like, okay, maybe cannabis use disorder exists, maybe not, I don't know.
That's another whole subject.
Well, that
right?
we can come back to that, absolutely. I'm actually much more convinced that I do know now, and I think it does exist, but one has to be thoughtful about how you make that diagnosis, and
Right.
oftentimes we're not. But it was through this process of going, well, if this is medicine, and I'm not seeing anyone sick from it, maybe we should be taking this seriously. And that sort of prompted my own drive to learn about it. So it took a couple of years to really read deep into the literature. And anybody who tells you that the literature doesn't exist, that we just need more studies, isn't paying attention.
They're not really doing the research
That's
that
right.
they can be doing.
Exactly. One of the things I'm quick to say is, look, every field needs more research. Cardiology is one of the most researched fields in the world. And yet we would never say, okay, we know it all, we're done, right? And we work from the knowledge that we have now, and we make the best decisions based on what we know now, knowing full well that the story isn't done and that we will gain greater insight in the future, and maybe even discover that what we're doing now turns out to be not so good. And cardiology is a great example, because we used to use digoxin all the time. We don't use it
Right.
very much anymore because it turns out that it wasn't as helpful as we thought it was. And this is true for cannabis. What we know about cannabis is a lot, and we can make some very sound clinical decisions for people today that are legitimate and helpful, knowing full well that there are also aspects of it that we don't know and that we need to research further, and maybe, I would expect, it will change our approach to practice down the line, but that doesn't mean we should be standing still doing nothing for our sick patients now.
Right.
So
Exactly.
So the cannabis use disorder, because there's a lot of
you want
confusion.
to jump
with-
into that? Okay.
Just
because
a little bit.
Well, I
Sure.
see it a lot when patients come in. I look at their
Chart.
problem list.
Yep.
I see that they have this listed. So addiction, dependency, cannabis use disorder. Can you talk a little bit about that, and how do you come to the decision that somebody, because patients are already afraid to talk to their physician about that, or their provider, and because they don't want to be labeled.
Well, I think the labeling aspect of things is really a problem, right? I mean, the only value in a label is if it helps us help somebody, right? And so there are definitely people who develop a problem with cannabis. And so we have to say, whose problem, right? Is it the cop who says that you have a problem? I think not. I think if the patient says, I want to stop using this substance and I don't seem to be able to stop, that is their definition of a problem, and I think that is real.
Yes.
But by that definition, the number of people who fall into that category is much lower than, for example, if you look at the number of people who are labeled as cannabis use disorder by the mental health field, where many of the people who come into detox programs are remanded there instead of going to jail when they got caught with their cannabis. So that's not, I think, a particularly good definition of cannabis use disorder, because it's no longer about what the patient needs and how they feel about their use. It's about they got caught and they had to admit to something in the psychiatric realm in order to avoid going into the clink.
Right. Right.
That, to me, that's coercion.
Right.
And there are some significant financial outcomes that put that system forward. It's great that people aren't going to jail over this, but then you've installed an industry that makes a fair amount of money from filling beds with cannabis users. And in
Right.
fact, if you look at some of these treatment programs, if you remove the cannabis remanded patients, they would not have enough volume to keep their doors open. And so you can see that there's a fair incentive for them to keep those beds filled.
Right. So we all have an endocannabinoid system, and we all have a reproductive system.
Absolutely.
And basically, as we know, the endocannabinoid system regulates all of the other systems in our body.
Yep.
And since we're going to be talking about cannabis and sex, the biggest question I have, can cannabis improve all phases of human sexuality?
Interestingly, the answer is yes. And one of the things we have to do is put this in the context of what are our sort of other conventional options. And really, we haven't got very many, right? When it comes to women, frankly, we've got nothing, really. When it comes to men, we have drugs like Cialis and Viagra and stuff like that, but those focus entirely on erectile dysfunction, which is a significant problem, but it's only one of many problems that can occur. And they don't do anything for any of these sort of other aspects of
So
things.
in other words, the other aspects, which mean
Right.
biopsychosocial, spiritual. So it might be working on
Exactly.
the physical inability to have an erection, but then you're not touching upon the mental, the social, the spiritual, the components that incorporate good health.
Absolutely. And then also we have to recognize that, so people have trouble with one or more of these phases, so that erectile dysfunction is one issue, but that they may have other issues as well, or if we're talking about women, that there's a whole host. So we should just step back and talk about these phases for a moment.
Sure. Oh, yeah.
So really,
desire.
Right. So you can kind of break this down into 4 phases. There's desire, or libido, people commonly use, and then there's arousal. So in men, that's the ability to get and maintain an erection. And in women, there's muscle relaxation and lubrication that needs to happen. And all these things sort of have to happen in their proper order before sex can happen, right? And then you get into sort of the mechanical phase of doing it, right? And then hopefully there's an orgasm, at least one, maybe more.
Maybe more.
Maybe more. And after that, then there's this phase that we call satisfaction, which is sort of after it's all said and done, how do you feel internally, and also how do you feel about your partner and that sort of thing. And what's really interesting, connection, exactly. I mean, in some ways the question really is, why have sex? Why not just masturbate all the time? And the answer, I think, is that there are ways in which masturbation is better than sex.
You get to know yourself.
Absolutely.
Reach out and touch yourself.
And perhaps you even have a better orgasm in the truest sense of just focusing on sort of the quality or intensity of that orgasm. But it's fairly unlikely that masturbation is going to lead to that kind of intimacy and connection with another person. And I think that for most of us, past a certain age anyway, is really the driver of why we have sexual relations.
So how does cannabis affect men and women differently?
Oh, that's a good question. Going back to our phases.
Phases, yes.
Right?
That's good. You're talking about men, the men and the desire, the women and desire.
Well, one of the
men
things
and
that
arousal,
we don't
women
really
and
understand, like when women hit middle age, there's all this discussion in the press about how they lose their desire and all that sort of thing. It's not realized and not recognized and not talked about much is that roughly 30% of men have decreased desire, right? If you think about it, that's a large number. It also means that where does this come up? It comes up in that the conflict between those men and their partners, right? If you have low desire and nobody's kind of complaining about your lack of interest, then what do you care, right? It's really a matter of that dyadic relationship where your desire is lower than your partner's and therefore there's some conflict. So we need to understand that men are not simply subject to erectile dysfunction, that there are issues around desire that are huge. So we can use cannabis in both genders to stimulate that sort of thing.
Stimulate desire.
Exactly.
Right.
And hopefully in doing that, what we can do is get the couple on a more even matching.
Right.
Right? And
Not
that's
so
really
much
what it takes.
dissonance.
Right, exactly. I mean, how much fun is sex if you guys are crabbing about, how often and how much and what kind, right? It's obviously much more fluid and positive if everyone's just like, hell yeah, let's do it, right? So the cannabis obviously doesn't override anything and may turn people into sexual zombies or anything like that, but it allows people to kind of equalize that level of desire, and that leads to a more harmonious relationship. And then it also helps with that arousal phase. So, and this is a little bit where the men and women differ. So for women, it tends to increase lubrication, it tends to decrease anxiety, which then also leads to relaxation of the perineal muscles that allow sexual intercourse to happen more readily and without pain, and those sorts of things. And for men, it can stimulate erections. However, it can also be difficult, right? So for women, there's less of an issue around the dose. You know, in general, my feeling as a physician is less is more across the board, not just with cannabis, with all medicines. But women kind of have more leeway in this area, that they can tolerate a higher dose and still enjoy the sexual
perform well.
Right. Whereas men, you know, there's a certain amount of focus that's required to both maintain the erection and also to go through the mechanics of sex.
Right.
And so if you're too high, you kind of lose that focus and things can kind of go awry.
Because you're in Jupiter,
That's
right?
it, exactly.
You're in Jupiter and you're thinking about Doritos.
That's exactly right. Exactly. You have to be in the moment, and cannabis can help you be in the moment, and too much cannabis can take you into some other moment, you know.
Right.
And so for men, there's that balance. And in general, I would say somewhere around the 10 milligram mark for most men tends to be kind of the sweet spot.
Right.
And then what's really interesting is that for both men and women, it can intensify the orgasm, so that, you know, you just have that much more powerful and overwhelming experience.
That explosion.
That explosions, exactly.
Oh.
It can make men multi-orgasmic. I mean, some men are multi-orgasmic to begin with, and we don't hear much about that, do we? And then,
But we'd like to talk. We'd love to hear from a man if you're multi-orgasmic. We'd love to hear from you. Please write.
Okay,
Ask
there you
at
go.
greennursegroup.com. It's a good.
So is it all about the inhibition, or limiting that inhibition, lowering it, or is there another biological reason why cannabis is so good?
I think that's a very good question that I think we don't really have the answer to in any concrete fashion. There's clearly some focus and in the momentness sort of effects and the decrease in anxiety, but we also know that some people also experience pain during intercourse. That, you know, cannabis, THC in particular, as an analgesic, as an anti-pain medication, may be having some direct effect there. And then I think that there's sort of a whole host of sort of higher level psychological phenomena that have to do with, you know, if we're looking at somebody who has sexuality issues, there are causes for that. Some of them biological and some of them are psychological. And so for women who may have a form of sexual PTSD, being able to kind of put that on the shelf because of the effect of cannabis allows, again, being more in the moment and connecting with the partner.
Connecting with their partner so they can experience joy and pleasure.
Exactly, absolutely. I think, you know, if things are intruding in your mind as you're trying to be here and now and enjoy that pleasure, it interrupts, you know, and with the cannabis we can kind of turn that down or turn it off for a while, and that's a good thing.
Yeah, that is a good thing.
So a lot of common medications today cause sexual dysfunction. That is a side effect.
Absolutely.
So and we see a lot of patients on these medications, so will cannabis still help them? Will they benefit from it?
Yes, actually, I think that for many people, those side effects of other conventional medications that they need and that are helpful to them but have these unfortunate side consequences can benefit from cannabis because they sort of override those side effects. And the classic example is an SSRI, right? Many Americans, for their anxiety and depression, are given an SSRI, and as a consequence of that SSRI, you may in fact have elevation of the mood, right? The depressed and the anxious gets better. But then people often talk about, but the joy gets a little squashed.
You become very flat.
Flat. I mean, my patients often say, it makes me feel like a zombie. I'm neither high nor low. I'm just there.
Boring.
Right. and I can understand that, absolutely. And what we really want is something that brings the bottoms up without squashing the top, right?
Right.
Well, cannabis, it turns out, kind of unroofs that top again, so you can go back to experiencing the joy in life without having to get back into that sort of bouncing between yes and no and the bottom of the pit. So cannabis works really well with a number of medications like the SSRIs to not only stimulate the kind of sexual stuff that we're talking about, but really to kind of override or remove some of the side effects that often come with those
With
conventional
pharmaceuticals,
meds.
yeah.
Absolutely.
And one of the side effects of cannabis, as we know, is it makes you thirsty. So is it?
Yeah, there's the myth.
Does this come up? Does this create a
Oh,
problem?
the dry vagina
The dry
thing?
vagina.
It's absolutely not true.
Because as we know, right, cannabis works on our salivary glands, very different than how it's going to work on our lubricating.
That's absolutely right.
lubrication
As
down
she
in that
gestures
area.
down there.
Yeah.
Well, it's exactly right. The mechanism by which vaginas lubricate is completely different from how we make saliva. And in fact, when we use cannabis and get a dry mouth, we're not actually dehydrated. We're not thirsty for the right reasons. What we have is simply that the THC interacts directly with those salivary glands and shuts them off, right? So it's kind of a missignaling situation. And so probably most people who have used cannabis in the past can relate to, if you drink a lot of fluid to treat the dry mouth, you immediately run to the bathroom to pee. Right? That's because your body isn't dehydrated, so you've actually now added more water in than your body needs. You're doing it because you're getting this stimulation of a dry mouth, which usually means you need to drink water, right? And in fact, in this case, you do need to drink a little bit of water to keep your mouth lubricated, but when we drink a whole cup of water, now we've actually had more than we need, and our body responds by making us urinate it out.
Right.
So the idea that because you can get a dry mouth, you're going to get a dry vagina is just not understanding the true biology.
Right. And if people do have dry vaginas, it's probably a different reason.
Absolutely. And we know that that women of a certain age may develop dryness in the vagina that has to do with the withdrawal of estrogen from the lining of the vagina. And that's something that's best treated by treating the problem, right? In some cases, maybe low dose estrogens topically or locally applied, if that's safe for a woman, which it's not true for every woman, or simply a lube, right? Which allows us to sort of override that problem with a product. And that works really well.
So estrogen is important too, estrogen sensitivity.
But before we get to that, because that's a good topic, the lubes that they're making now that are infused.
Yes.
How is that THC bioavailable? Is it going to make a difference, or will any lube that's available do?
When it comes to the dry vagina issue, then I think any lube will do, and I don't think that there's anything particularly about adding cannabis to the lube that's going to be helpful. There is some evidence that topically applied cannabis lube can make the tissue down there more sensitive, right? And for some women, that may be an advantage.
You mean for clitoral stimulation?
Yeah, clitoral or vaginal. But the point is that locally, sort of down there, some women are simply less sensitive than they would like to be.
And so the cannabis can increase their sensitivity so they feel more.
That's right. That's exactly right. But I would say that in the sort of scheme of sexuality issues, that's this much. It's not a very large amount. And what I typically say is, look, the vast majority of sexuality doesn't happen down there. It happens up here, right?
Headspace.
Above the neck. Exactly. And so if we put cannabis on our genitals, we miss all of that potential therapeutic benefit. All of the desire stuff, most of the arousal stuff, the orgasm stuff probably mostly has less to do with local sensitivity and more to do with being receptive to the explosion. And then obviously all of that connectedness and satisfaction, that's all going on in our heads, not in our genitals. So when patients come to me with these sorts of issues to discuss them, I don't point them towards the lubes in general. I point them towards systemic cannabis, meaning cannabis that we take into our entire body. And generally I point them towards some sort of inhaled cannabis because the onset is both rapid and predictable, as opposed to something that you take orally, like a gummy bear or something like that, where you know, it may take quite a long while before it sets in, maybe an hour, maybe even longer than that, and sort of, you know, how does that factor into your sexual?
Right, if you've got
Right.
your partner, right, one of them kicks in quick and the
Well,
other
that's
one
it
doesn't
too.
kick in, or someone's not kicking in at all, someone's eating chips, the other one's...
Right. So, you know, if you're doing this, in a couple, right, you want this to work, and you want it to work
Synergy.
right at the same time, right? You do not want to be sitting around saying, well, I wonder if this is going to kick in, or as you point out, one of them kicked in and the other has not.
The other one's like,
Yeah, exactly. So you know,
TikTok.
if you use a vaporizer, because that's safer than smoking, and in particular a flower-based vaporizer, because that's safer than the oil vaporizers, you can essentially work that process into the foreplay, right? You can share it and talk about it and get a little high and a little giddy, and then
have some fun.
That's right.
Right?
That's right.
What is, I mean, sex is not only for reproducing,
God,
but
no.
as adults, it's the playground.
It's enjoyable and it's interactive. And so again, being able to interact around the process of imbibing the substance that then sort of moves things downfield is a really good way of doing it.
Right.
You know,
Right.
people often talk about cooking these gourmet meals that are cannabis infused and stuff like that. And that kind of, at least for me, leaves me a little bit flat. Again, because of that synergy and the timing, but also like, you know, I remember somebody talking about making this wonderful sort of maple glazed cannabis salmon. And I'm thinking, now you've taken this beautiful recipe for maple glazed salmon and you've ruined it, making it taste like weed, right? And I know that there are people out there who really like the taste of weed, and more power to them. But I think for most people, the flavor of cannabis is not necessarily something that they want to look forward to in the course of their home-cooked gourmet meal. So again, I think, you know, obviously different strokes for different folks, but
Right.
when people come to me and they're asking my advice is, you know, take a few puffs on the vaporizer and then eat the meal and then go have sex.
There you go. That's a good idea.
Yeah.
Vaporizer, eat your
Try it
meal,
tonight.
go have sex, right? And then the different ways of using cannabis too. So one of the things when we talk about patients that are really sick and chronic illness and that are in pain and don't want to be touched.
That's right.
So cannabis can help, right? Not only if they're, whatever way they're taking it to manage their symptoms, but even the oils and the lubricants and touching. You know, people don't like to be touched when they don't feel good. And touch is so important.
Absolutely human.
We need
Absolutely.
it.
Absolutely. You know, even in the circumstance where we're not even talking about sexuality directly, but simply human contact, the ability to sort of relax, feel like the symptoms, that pain or the anxiety have sort of been lifted for the while, allows that kind of intimacy of contact and connectedness, even if we're not talking about sexuality necessarily,
Right.
just being able to
Massage.
snuggle, you know, that
Intimacy, like
Exactly.
intimacy, not even with sex or penetration, like increasing intimacy using cannabis.
Absolutely.
You know, connecting together, doing things that are
Yeah,
fun
that
together,
bonding
touching
experience.
one another.
One of the things we didn't talk about yet is that cannabis, we talked about the first three phases, but the last one, that satisfaction one, is really sort of almost where it, you know, it all funnels down to that. That's the therapeutic benefit.
Connection.
Connection, exactly.
Bonding.
And we actually know that cannabis stimulates the release of oxytocin, which is a hormone that has been connected with these feelings of connectedness.
Yeah.
And so, yeah,
And
it's huge.
yeah, so cannabis can trigger release of oxytocin. Orgasm can trigger release of oxytocin.
Yeah.
Right? Women that are breastfeeding their children stimulates release of oxytocin. So we have that close connected feeling.
Yep, absolutely. It's all connected, and we should be connected, and this helps for people.
Exactly. Exactly. So what are some of the, one of the things too that some women have, and we're talking about the endocannabinoid system, reproductive system, polycystic ovarian disease. And how that might help, cannabis might help. There's a lot of women that have that. It's a, you know, a hormonal imbalance,
Absolutely.
and how cannabis can help with that.
You know, it's an interesting area where we do need some more study, but I
Yeah.
would bet, based on my clinical experience, that this is an area where it would be very, very helpful.
Yeah.
Right? People with PCO can have a significant amount of pain,
Yes.
as well as sort of, as you say, hormonal imbalance that leads to all kinds of shifts in libido and
And
arousal.
also how they
that sort of thing.
process food, how they process, you know, they become insulin resistant, they become overweight,
Absolutely.
they develop, you know, it's truncal obesity, a lot of facial hair.
Right.
You know, so it's the endocannabinoid system, and using cannabis can really help these women
Absolutely.
start to regulate their systems. Yeah. So what about studies? Any studies out there? Any sex?
Oh
Any
yeah,
sex.
there's.
Any ongoing?
So there was a study. This is maybe 10 or 12 years old, that I thought was very instructive. It's one of the things that got me into thinking about cannabis for sexuality. So there were some intrepid researchers in London who wanted to look at cannabis for sexuality. And they wanted to be rigorous about this. So they invented a device to measure female sexual arousal, right? So this device measures vaginal contractions and vaginal lubrication. So not surprisingly, as you might imagine, this contraption, when all said and done, looks a lot like a dildo, right?
Oh my.
Right? Because form, function, etc.
Oh gosh.
So then they managed to find a whole bunch of healthy female volunteers who came in for the experiment, in which they inserted this dildo-esque thing to measure, and then they showed them some videos. So the first video was news, like CNN. And as you might expect, not a lot happened, right? Because CNN doesn't usually turn people on too much. And then they showed these women some pornography. And, you know, maybe there was a little bit more reaction, but it wasn't something that was particularly overwhelming. Then they gave the women some cannabis. And unfortunately, in that actual study, they didn't use cannabis, they actually used IV THC.
Oh.
But in any case, it was in the right direction. So now the women are high, and again, they showed
Wait,
the
so wait, the
CNN.
women are high. They
And
have this internal machine in their
That's right.
vaginas.
Exactly.
And
they're
they're
in a
watching
lab.
and then they're in a lab watching CNN and then porno.
Well, so here's the thing. So then they show them the CNN again, and again, nothing happens. So there's your control group, right? And then they show the pornography, and suddenly the meters are jumping. Like, all of a sudden, this is working. And so my conclusion from reading this study is cannabis can even make bad porn interesting. But, you know, this is how we understand, these are the kinds of experiments that lead to our understanding that, in fact, using cannabis can increase desire and can increase arousal. This particular study didn't look at orgasms or satisfaction, but there are other studies out there that do look at those sorts of things.
Right. There was another article that I had read that you had contributed to that talked. It was a 2015 study in the release of oxytocin. You want to talk a little bit about that?
Well, I think we don't really know that much about why. We just know that it does, and as a result of its being released, that leads to the kinds of phenomena that we've been talking about in terms of that bonding and intimacy and sort of snuggling good relationships. And it's not clear to me why that happens,
Right.
but I think at some point we can simply accept that it does, and we can use it for our benefit, while others of us are going out there and figuring out the why.
Right.
So for patients that haven't tried cannabis before, and
Yes.
they want to try it for the first time in the context of sex, what do you recommend?
Well, so the first thing is, how are you going to take it, and then what are you going to do about it? So the first thing I suggest is, again, that vaporizer, right? There are many, many different vaporizers out there. Some of them are better than others, but the basic idea here is that this is a machine into which you put your ground cannabis material, and it heats that material to a very specific temperature. And it turns out that that temperature is 350 degrees Fahrenheit. And I always say to my patients, just like we were making cookies, right? And that's the temperature at which we get all of the medicine that we need.
Where
but
we
we're
can
not-
get baked.
Good.
Sorry,
good.
I had to put that in there.
Yes, I can see you were waiting. You're like, oh, what's she going to come up with?
I'm sorry.
No, it's great. It's great. Listen, we're talking about sex and we're talking about cannabis. So if we can't have a sense of humor, then we're brain dead, right?
Exactly.
So absolutely.
I'm sorry. I didn't mean to lose your train of thought.
No, but I wanted to talk about the vaporizers for a sec. So the
Yeah.
point is 350 is wonderful. We're getting the medicines, but we're not getting any products of combustion. So it's the safest way to
We're
do this.
steaming it. So we steam the cannabis leaves to release the oil that we can inhale.
Yeah, more
Right?
or less.
Just try to.
And so this is, I think, helpful for the people who are saying, I've never done this before, I'm a little nervous about it. I think it's reassuring to them to say, look, we don't recommend smoking. You're not going to get any smoke. You're just getting the medicine. I think that's a good starting point for some people. And then I tend to teach people how to use the vaporizer in a way that allows us to get a fairly consistent dose. But we want a low dose, right? We want to
Start low, go slow.
Exactly. We want to get the toe in the water. We don't want to jump into the deep end of the pool. And it's very easy, if we're not being thoughtful about this, to end up at the deep end of the pool. And unfortunately, our culture at the moment in the cannabis space tends to point people towards the deep end of the pool pretty
And that's
easily and quickly.
when Dale and I teach about cannabis, one of the things that we say, there's 3 ways to use cannabis: medically, recreationally, and irresponsibly. And it all has to do with the consciousness that you have when you're going to consume.
That's absolutely right.
And always
Absolutely.
starting low and titrating up very slowly, like we do with any medication.
And I think the other thing on the titration side is that, you know, when we get to the place where it's good, then we need to stop there, right? And
Yes.
sometimes there's a, you know, the advice that maybe people get at the dispensary or from their brother-in-law or whatever is, you know, more is more.
Yeah.
And so you titrate and titrate and titrate past the point where you're getting that benefit, into which you're really kind of just getting more side effects, more stoned,
Right.
more dry mouth, more confusion, those sorts of things. And at some point, there's really not any benefit in that. And certainly,
yeah.
when we're talking about the sexuality stuff, that's a prime example, right? Whereas a man might do really well on 1 or 2 puffs on the vaporizer, at 3 to 4 puffs, he's sort of no longer with
It's
it.
in Jupiter.
Right, exactly. Then
Yeah.
the other thing that I tell people is, you know, if you're really new to this, then start out doing this by yourself, right? Go home, make sure you have some time on your hands, set the mood, right? Make sure you're in a safe place. Your, 12-year-old isn't going to walk in on you, right? And then take a
Your
couple
vaporizer
puffs.
and vibrator, right?
Right, take a couple puffs and then, figure out how that makes you feel and masturbate so that you get an
Learn.
understanding. Exactly.
Self-awareness, body awareness.
Would you also recommend that for, say, a couple, one is a user and the other isn't, so for that person,
yes.
they should start on their own before they try it out with their partner that's already experienced?
Absolutely. And whether that member of the couple wants to do it totally on his or her own, or maybe with the partner, but in a non-sexual fashion.
Right.
So, you're going to get stoned now a little bit, and then you're going to masturbate, and I'm going to walk you through it. Essentially, the more experienced partner acts as a guide, but without the expectation of intercourse during that episode.
So you're building trust, you're building intimacy, you're building connection.
Yeah, shared experience. And,
Right.
For people who are truly new to this, it can be a bit daunting, largely because of the fear of the unknown, not so much because of the actual medicine, but you kind of do have to get into a comfortable space to get over that pun intended hump, and really feel like this is okay. That
Right.
you are, I think a lot of people worry that they're going to be out of control, that they're going to turn into some stupid or drooling moron or pass out or any of those sorts of things. And there's
Vulnerability is tough for people.
it is, especially, sort of self-inflicted, like, oh my God, what have I done to myself? And you know what? If you take enough cannabis, you can get yourself far enough out there that you really can have those sorts of problems.
Right.
But again, if you're doing this in a responsible, mature fashion for a purpose, you are going to go at this very slowly. And you're not going to go and light up a big fatty and smoke the whole damn thing and then be wondering why you can't find your feet, right?
Never mind your vagina.
Right, exactly. So, there's just ways to do this
Right.
that work really well. And there are ways to do this that are just incautious, and you can end up being kind of miserable about it. The goal, obviously, for all of us is to help our patients figure out how to do this in a gentle and thoughtful fashion so that they have a really great outcome. I mean, that's the whole point. And, after you've kind of got this sense that the sky isn't going to fall while you use this stuff, then you can relax enough to sort of use it together and get in the bed together and sort of work on that sort of thing. Or not in the bed, in the treehouse or wherever it is you want to go to do it,
A kitchen counter.
Kitchen counter, right?
There you go, Dale.
Not that I've ever done it on the kitchen counter, just for the record.
Yeah.
But so a lot of patients, I haven't had any patients talk to me about sexuality. You're known for that. So what would make it easier? What do you recommend for patients? How do you talk to your provider about sex? How do you bring this up?
Oh boy, that's a really good and a complicated, difficult question. I think, if we leave cannabis out of it for the moment and just talk a little bit about how often do people with sexuality issues, for lack of a better word, talk to their providers at all, the numbers there are dismal.
Yeah.
So
Yeah,
for women,
it's not
about
addressed.
30%. For men, it's less than 25%, probably lower in the single digits to teens.
That's the percentage of people that will actually talk to their physicians.
That's correct. Now, an interesting study was done some years ago asking the question, well, if people aren't getting the sexual help from their providers that they need, is that because the patients aren't asking or because the providers aren't willing, right? And I think a lot of us might have thought that the providers would telegraph that they weren't willing, right? But it turns out that 75% of polled providers were ready, willing, and able, which leaves 25% who weren't, and we need to work on those folks a little bit. But the point is the vast majority of providers turned out to be able to do this kind of discussion, so that the onus really ended up more with the patients and their uncomfortableness about that. Now, of course, as a professional, the goal is to be able to bridge that gap and to be able to say, look, this isn't on my mind, it may be on your mind, let's bring this up and see where things stand. I think that's another step, and that wasn't included in that study that I just mentioned. That is to say, being passively ready to address it is different from actively seeking these issues from your patients. So we have some progress to move there. But really, when it comes down to it, I think that the patients need to feel comfortable with their providers across all range of illnesses. I mean, how many patients are comfortable enough to talk to their patients about depression or anxiety? And the answer is probably a lot fewer than are willing to talk about their blood pressure, for example.
Right.
But it is our goal as a profession to make this more available and to make ourselves physically and emotionally available to our patients so that they feel the comfort to be able to bring this up when it's necessary. And then and then on some level we also have to say to the patients, look, if this is bothering you,
You need to tell me.
yeah, right, damn whatever you think of the provider's response, you might be surprised that they're more receptive than you think, and just kind of lay it out there.
Yeah.
That's tough in our puritanical societies.
We're
So,
always encouraging
yeah.
our patients to you really need to communicate with your doctor. I mean, that your doctor's working for you.
Right? It's very hard to help you with something that we don't know is a problem,
Right.
Until you tell us.
So with depression, for example, we're starting to screen more in primary care, although it's still very limited. Do you think we should be screening? Should providers be starting the conversation? Is it their
With depression.
responsibility? No, with
No, with
depression,
sexuality.
sexuality.
Yeah.
I think that sort of logistically, I think that's a great idea. But the flip
We
side
won't
of that,
be reimbursed for it, though.
well, I don't know about that. I bet we would be. But what I think is the problem is that if you look at and this is way beyond all of our pay grades, unfortunately, but if you look at the problems that we have with primary care in the United States, the biggest issue is that you get to see your doctor for 10 to 15 minutes.
Yeah.
And that doctor has to deal with anything and everything that's on your mind, plus a whole bunch of things that's on her mind because, the government says you need to screen for this stuff or whatever. So, whether it's blood pressure or seat belts or bicycle helmets or pap smears or any of those sorts of things. It's a very long laundry list of things that you want to squeeze into a very short period of time. So in some ways, I think the idea of screening for sexual health is very important, but I'm not sure we can shoehorn it into something that's already bursting at the seams. It's part of the reason why I started practicing cannabis medicine the way I do, which is to say that when I looked at my colleagues and thought about what they were already faced with in that short window of time, I thought taking on cannabis medicine is never going to happen. It takes too much time. So when I see my patients, I spend an hour with them up front. That's already 4 times
the amount of time,
and I'm only talking about one problem with one potential solution, not this whole array of stuff. So it's been very successful to me, or for me, to be able to go back to my physician colleagues and say, this is why I set up my practice as a specialty clinic, and we co-manage patients so that you don't need to know or have the time, which you don't, to really get into this in the depth that it needs to be gotten into. You just need to know when it's appropriate to send somebody to me.
Right.
And then we can work on treating that patient together as a team. That's been incredibly successful.
Well, I want you to share with everyone about your practice, inhaleMD.
Sure. So I have an office in Brookline on Beacon Street and a new office in Cambridge out on Concord Ave in the Fresh Pond area. And we've been at this for over 5 years. And we've got thousands of patients who are doing really well using cannabis. Take a very sort of, we talked earlier about my sort of traditional background. I take a very serious and traditional approach to this in the sense that I really get in there and talk to patients about what's going on with them and listen to what is on their mind. And then I have a packet of material that we go through so that they come away with a very thorough education as to what cannabis is, how it works, what it can do for you, what it can't do for you, what are the pitfalls in interacting with a cannabis dispensing system, how not to end up buying things that are not good for you and that sort of thing. Right. And at the end of it, it boils down to what I call my prescription-y thing. And I call it that. I mean, I make a joke of it.
Wait, what is it?
Prescription-y thing. And I call it, because basically it says what a prescription should say. It says, get this kind of a product, use this much, use it this often, buy this much. This is what you would write on a prescription. The only difference is that it doesn't have the force of law to make the dispensary do what I say. Unfortunately, that's still on the patient, which I think is problematic for patients, that level of agency is difficult. It's one of the reasons why the pharmacy system was developed, so that agency was,
their expertise was honored.
Right. Not just my expertise, but also it takes the patient out of the position of having their arm twisted.
Right.
Right?
Yeah.
If you go into a pharmacy with a prescription for a blood pressure medicine, they sell you that medicine. There's
they're not going to try to
wink,
sell you
wink,
something else.
Right. Would you like some Percocet with that? Right. They can't do that. It takes that profit motive drive out of the equation. We just love. Yeah. So I think we need to get back to that because because the current cannabis system puts a vulnerable patient in an awkward hot seat position.
Yeah, and we've seen that
a lot.
A lot.
Unfortunately.
Because the bottom line is when we're educating and working with patients, our question to them is what's important to you and how do you want to live your life? We not only look at medical diagnoses, we look at symptoms, we look at lifestyles that play such a huge impact. And how do people want to live their lives and what type of cannabis would work best with them making the decision based on our education.
Absolutely right. A great example of that is, I have patients who are very high functioning individuals, lawyers, doctors, bankers, etc. So to say to them, you get up in the morning and you take your cannabis by whatever means, and then you go to work, well, that's a non-starter for a lot of them, right? So we have to figure out how are we going to treat their illness or their symptoms in a way that allows them to be
live their best life,
to be functional, to be able to do what they need to do. No one wants to trade their career for whatever the benefit of cannabis is, right? They need both in the best possible combination that they can get.
And the other thing is the patients that don't want the intoxicating effects, but they still want to use cannabis, and then they go to the dispensary and they call and they talked me into buying, and then they end up with all these expensive products that
Very
they aren't
expensive.
willing to use, or
They were
somebody that's
talked
at a
into
risk for
using-
falls, and now they're using cannabis at such a high dose that it's
Yeah,
inevitable.
they're out of it. They're at risk
Yeah.
for fall. They're at risk for developing tolerance and possibly even dependence. I get calls from my patients periodically that, doctor, I don't feel well. Well, what are you doing? Well, and they say, that's not what I suggested to you.
Exactly. I know.
And I even often go back in my notes and I'm like, okay, just reassuring myself that I didn't say that.
Yeah.
And they so why are you doing that? Well, the guy at the dispensary said, and the classic is I might send somebody in, buy 1/8 of an ounce of flower that contains between 15 and 20% THC. So relatively low potency, which is hard to find. And then, somebody at the dispensary says, here's a bottle of keef, just sprinkle some of this on top.
Oh my
before
God.
so now you've taken something from 15% THC to 65% THC, and you wonder why you're feeling a little miserable. Well, you just overdosed on this stuff. And sure, it's not going to kill you, but it can sure make you miserable.
Right.
And these are the calls I get.
Dose dependent. That's what it is.
Absolutely.
It's personalized
And it's
medicine.
very
It's
personal.
customizable, and it all has to do with not only your diagnoses, but the medications you take and what you're doing, what you're eating, how you're living your life, your stress management, everything.
And what
Absolutely.
your desires are of the effect that you're looking for.
Right.
I don't know too many patients whose desire is to be blitzed. Right? I mean, that's
right.
pretty much the opposite of what. And I'm not casting aspersions on recreational use. I think it's perfectly fine. But in those circumstances, some form of intoxication on up to blitzed is the goal, right? And that leads to a desire to experiment. What happens if I roll up a bigger joint? What happens if I lace it with a little bit of shatter? All those sorts of things are exploratory, and
that's okay,
it's
but
absolutely okay, but it's a very different purpose and mindset.
Yes, than
Patients,
using
on
it
the
for
other
medicine.
hand, want a particular result, and they want it every time with reliability. It's not exploratory. They want to know, what do I do so that I have a desired outcome that is reproducible?
And
that's
that- yeah.
absolutely different from what happens if I chug a cannabis soda, right?
Oh my
So-
gosh, sugar.
Yeah.
Right. Well, that's another issue. But so the
Right.
point is that the intentions, the desires, the needs are so radically
Right.
different that we really need systems that address the needs of both groups, and they're really so distinct. We need something where for patients we can say, here is a little product, it doesn't have a ton of calories in it, right? But it's going to get you just the right amount of medicine, and it's going to work exactly as you expect each time.
Right.
That's to a stoner, affectionately termed, that would be boring. Like, why would I want that?
Well, can I
Right.
tell you what's interesting? And I have to say this. I've worked with a couple of stoners
Sure.
that have come to me and said, I'm doing this, this, and this, and I don't like the way I feel. I'm like, well, it's because you're not doing it right.
Right.
Let's just start over. Clean slate.
Yep.
Right? And you got to figure it out, because if it's not working the way you want it to work, then you're not doing it right.
And if you use this stuff a lot, meaning both frequently and also at high dose, you will cause changes in the biochemistry of your brain in particular that will lead to that kind of, it's not working the way I want it to be, you know? And that we can get into a position through recreational use where we have kind of tweaked our brain in a fashion where this sort of more medical approach doesn't work so well, and we have to
Right.
kind of do a reset.
Yes.
So that desensitization period, what do you recommend to patients to stop using
Well,
altogether?
In general, I don't recommend a reset for most patients. And the reason for that is if they're using cannabis to treat something, then the idea of withdrawing it for a prolonged period of time seems kind of cruel, right?
Yeah.
Yeah.
If I'm having a lot of pain, I don't want to go 2 weeks in pain. So in those cases, what I tend to do is try to slowly wean it back.
Right.
And what I've found is that that's a tough sell, number one. I mean, for a lot of folks, they're like,
Or what I've found helpful is introducing different cannabinoids. So in other words, if they're using too much THC, we could introduce a different cannabinoid, THCA, some of the acidic forms, the raw plant, juicing, right? Other ways that they're still getting the cannabis in their system to help promote homeostasis or balance in our bodies, but decreasing some of that over
Absolutely.
Neurotransmitter saturation,
Absolutely
receptors.
right. I think that some of it comes down to their being willing to kind of trust us enough that we're actually going to make them better than they are, even though we're saying decrease things a little bit.
Right.
But, and that's a tough process, and it takes weeks. So I just generally say, this is not a high pressure situation. We just want to kind of slowly and gently ratchet this back a little bit. And what people find is if they do that, they actually get more benefit with less.
Right.
And so that's, I think, a great thing. Occasionally I do, suggest a tolerance break. And then usually 2 weeks seems to work pretty well. I mean, I know that there are people who talk about doing it for a month, which seems a little bit excessive to me. And I know that, Dustin talks about 2 days.
Right.
I have not
effective?
seen that work.
I've seen it work 5 days,
Okay.
but I have people do things. I have them eating a lot of fresh fruits and vegetables, especially citrus.
Okay.
I have them doing earthing. I have them doing cold showers. I have them doing exercising, moving, doing things to really upregulate your endocannabinoid system naturally.
Interesting. Yeah, very
Right?
interesting.
And I've found that helps. Dr. Tishler, we are running out of
This
time.
has
Are
been
we? Oh, that's
But
too bad.
Amazing.
We're going to wind down in just a second, but I want people, what is your website? Please tell everyone what your
So
website.
if you guys want to get in touch with me, please don't hesitate. I love hearing from you all. So go to my website, which is inhaleMD.com, and you can read, we've got 100 or so articles on this subject for people to look into. And obviously you can email us through that. You can also phone us if you're of that mind. The number is 617-477-8886.
Dr. Tishler, thank you so much for being
Oh, it's
on. We
my
will have
pleasure.
you on again. We've got
I
a
look
We
lot
hope
forward to
you'll
it.
come back. This
We hope
was
you'll come
really
back.
incredible.
Absolutely.
Yes. So before we wrap up the show, we like to talk about a little bit about how with the Green Nurse Group, we're a whole health nonprofit consulting agency. Dale and I work together, and she does certifications, and I do consultations as well. And what is really important for us is how we can help serve the underserved. There's a large patient population out there that just doesn't have the financing or the funding to get the care that they need. Cannabis can be expensive. So we have smile.amazon.com. Green Nurse Group is a 501(c) nonprofit, where so if you go and you shop at Amazon, you can go to smile.amazon.com, load up your cart, and you can pick the Green Nurse Group as your charity.
No cost to you. It just comes right off the cart.
Right.
That's brilliant.
Yeah.
And then also Facebook has a charity. So if you wanted to have a fundraiser for your birthday and you want to, the Green Nurse Group patients could use some help, you can contribute to that. And that money goes to the Green Nurse Group so we can serve the underserved. How is that money spent? I've used that money to pay for $50 going to Mass General Hospital. I had to see a patient in the hospital. That funding helped pay for that garage visit.
Paying for medication.
Paying for medications
Yeah.
and really helping people to get what they need. Some of our upcoming shows that we have, we're going to be talking about cyclic vomiting syndrome, gastrointestinal disorders, nutrition, as the holidays are coming around right now.
Very big, yes.
Eating is huge, depression, anxiety, post-traumatic stress. Everything, we are going to be talking about a lot of different things that are going to help you to stay well, to live your best life through the holidays. So, thank you so much
Thanks
for
for
watching
joining
us.
us.
Please join us next week at the same time. And remember, it's all about living
Your
your
best
best
life.
life.